World War II, the Nazis feared many things, but one disease terrified them more than bullets: typhus, and one doctor used that fear to save thousands. During the Holocaust, survival often depended on luck, silence, or escape, but sometimes survival depended on deception. This is the story of Dr. Eugene Lazowski, a Polish physician who didn't carry a gun, didn't lead a rebellion, and never fought on a battlefield. Instead, he created a fake epidemic so convincing that the Nazis ran away from an entire region, leaving behind thousands of Jews and Poles who would have otherwise been sent to death camps. This was medicine turned into resistance. This was science used as a weapon of mercy. Eugene Lazowski was born in 1913 in Poland. He trained as a doctor before World War II, a profession built around saving lives, not risking his own. When Nazi Germany invaded Poland in 1939, everything changed. By the early 1940s, Lazowski found himself working in the small town of WWII, near the Jewish ghetto of Stalowa Wola. The rules were clear and brutal. Jews were forbidden from seeking medical help from non-Jewish doctors. Helping a Jew was punishable by death. Entire villages could be executed for defiance. Yet, Lazowski treated Jewish patients anyway, secretly, quietly, at night, because for him, medicine had no race. The Nazis were ruthless, but they were also terrified of disease. Typhus, a deadly illness spread by lice, had devastated armies for centuries. German soldiers were instructed, avoid typhus zones at all costs. Villages suspected of infection were quarantined, isolated, left alone. No raids, no deportations, no executions. The Nazis feared typhus more than they feared rebellion, and that fear could be used. Lazowski's friend and colleague, Dr. Stanislav Matalewicz, made a discovery. There was a harmless bacterium, Proteus OX19, that could trigger a false positive typhus test. Injected into a healthy person, they would not get sick. But blood tests would say they had typhus. To the Nazis, positive test was enough. And suddenly, an impossible idea formed. What if they could create an epidemic without anyone dying? Lazowski and Matalewicz began quietly injecting villagers. Not everyone, just enough. The elderly, the weak, people most likely to be tested. Soon, German records showed rising typhus cases, entire villages marked as infected. The Nazis responded immediately. They quarantined the area. German patrols avoided the villages. Deportation trucks stopped coming. The Jewish ghetto was left untouched. Behind closed doors, Lazowski was saving lives, one injection at a time. An estimated 8,000 people were protected, all because the Nazis believed a lie. But deception is fragile. If even one German doctor examined the patients closely, the truth would be exposed. In 1944, the worst happened. A Nazi medical inspection team arrived. They examined villagers, but Lazowski was careful. He selected patients who looked weak, appeared malnourished, lived in filthy conditions. The doctors were disgusted. They rushed through examinations. They took blood samples and left quickly. The test results came back positive. The Nazis confirmed the epidemic, and they fled. The lie survived. Eventually, Lazowski's activities attracted suspicion, not from Germans, but collaborators. He and his family were forced to flee. After the war, Lazowski emigrated to the United States, where he became a pediatrician. For years, his story remained unknown. He didn't call himself a hero. He didn't seek attention. He simply said, "I was a doctor. It was my duty." Only decades later did survivors begin telling the truth. Entire families were alive because one man understood fear and chose compassion. Eugene Lazowski didn't save lives by force. He saved them by understanding human weakness, fear, ignorance, panic. He turned Nazi cruelty against itself. In a world where death was systematic, he created a system of survival, not through violence, but through science. History often celebrates generals and conquerors, but sometimes the bravest resistance comes quietly, from a doctor with a syringe, a lie told to protect the truth, and a reminder that even in humanity's darkest hours, compassion can still outsmart evil.